High blood pressure. The purple drink that has long-lasting reduction on hypertension. This sounds fun. Let's do a fun one. Daily Express. I accept. I don't know what I accepted too. Hypertension and beetroot juice. The purple drink. High blood pressure, also known as hypertension, can lead to serious cardiovascular problems. Fortunately, you can reverse your reading by drinking a purple drink every day. You know it's beetroot juice. It's always beetroot juice. I'll get this out of here. Yeah, daily ad. Too many ads. It's called Daily Express, but they should call it Daily Ad. Okay, what do we have here? High blood pressure increases your risk of heart attack. Okay, we know that. Let's look for something new. Fortunately, you can reverse this harmful mechanism by making healthy lifestyle interventions. Diet is key. Specific items have been touted for their blood pressure lowering capabilities. Note, and I do have a series on my YouTube channel that goes over natural remedies for hypertension, and it goes through herbs, it goes through different fruits and veggies, and even sunlight. So check that out. There's at least 4 of them. The list is just ongoing. I have a list of like 80 remedies right now. Let's look into this one. I know it's beetroot. Okay. Hypertensive patients who drank 250 milliliters of beetroot juice a day were found to have a blood pressure levels back to normal range by the end of the study. All right, so the effect is caused by the high levels of a type of chemical called nitrates. Nitrates, nitric oxide, think vasodilation, widening of the blood vessels, allowing more blood to flow at a lower pressure. So nitrates is key. This is found in high quantities in beetroot and other leafy green vegetables like kale and cabbage. The study, involving 64 volunteers, points to long-lasting reduction in blood pressure by supplementing the diet with nitrates in patients with high blood pressure. The level of reduction was similar to that, similar to actual blood pressure medications. What's more, no adverse side effects were observed in these people. Commenting on the findings, the results suggest that supplementing the levels of nitrate in the diet can be a simple and effective way to manage high blood pressure. But a study on many more patients is needed before the approach can be a recommendation. Because remember, they only said 64 people. But there are multiple studies on this as they look into beetroot juice and just nitrates, like nitric oxide in general. And they always lower blood pressure. And the only difference is the length of time. Well, 2 things though. The amount of beetroot juice you consume. So they said 250 milliliters. I don't know what that is. Let's see this. 250 milliliters to ounces. 8.5 fluid ounces. That's a glass. That's not a full glass, but it's like half a glass. So you probably take double that naturally because you usually fill up your glass. So if you drank a glass of beetroot juice a day, every day, it will definitely lower your blood pressure for the most part. If your issue is you have constricted blood vessels, or you have so much plaque building up in your blood vessels that the volume of blood goes lower because you don't have enough room for that blood to flow. So meaning people have plaque buildup, hardened arteries, things like that. Beetroot juice helps. Anything with nitric oxide helps. If it's more so a kidney thing causing your high blood pressure, beetroot juice may not really help as much, right? So you want to think about that. When you stop taking the beetroot juice now this is where the studies kind of become a little different. Some say it's a long-lasting effect, like this is long-lasting. I don't know what long-lasting is, but I've seen other studies that say after a few days or a few weeks, that blood pressure might start going up after you stop drinking beetroot juice. So in my previous research, it hasn't been long-lasting results past the time you stop consuming beetroot juice. But the good thing is, beetroot juice is just good for you. It's full of antioxidants. It's healthy, it's nutritious. You can just keep drinking it forever, you're not going to experience any adverse side effects. So why not just make it a part of your everyday diet? What else do we see here? For those looking to work dietary nitrate into their daily diets, the trick is not to boil the vegetables, as dietary nitrate is water soluble, but steaming, roasting, or drinking it in the juice is positive. So, a steamer is a good thing to have in your kitchen. When you're trying to eat more vegetables, you don't want to break them down to the point where they don't have the benefit you're looking for, like the nitrate that you're looking for, or even some of the nutrients you're looking for. Get a steamer. Sometimes roasting helps. It depends on the vegetable. It helps with the root vegetable. You can still do like carrots and beetroots, even potatoes, and roast them without losing a lot of benefits. But there's some vegetables that wouldn't even work for. So, be cautious of that too. In addition to increasing nitrate intake, potassium can also help lower the blood pressure. Right. The American Heart Association explains, the more potassium you eat, the more sodium you lose through urine. So look at that. Look how important that relationship is. And the day where people are getting too much sodium, what do you do to balance that out? You consume more potassium, that's still more fruits, more veggies. Don't salt your veggies too much. Just eat them naturally. Maybe add herbs to them. But eat them that way, get more potassium in, and dump some of that sodium. If you're on a diuretic, sometimes you have to talk to your doctor to see, okay, how much more sodium can I take? Because it might exacerbate the effects of the diuretic. But the question is, if you consume more potassium, can you eliminate the need to even take the diuretic, right? Because those potassium foods are doing for your kidneys what that medication should be doing. So maybe at some point you can ditch the diuretic and focus on, eating right. But you have to remember, if you're going to eat right, stick to it. Don't eat right for a month and then try to get off your medication. Get off your medication and gradually go back to eating the way you used to, and your blood pressure's back up. You have to be able to maintain your results and maintain that healthy diet before it's safe to really kind of get off your medication. Sodium causes blood pressure to rise, so it's imperative to mitigate its effects. Sodium has, to explain that further, back to your blood vessels, your blood vessels need to be able to move. It's kind of hard for me to do it, but they need to be able to expand and contract all the time. So sodium is the electrolyte that helps them constrict and become tighter. Potassium helps expand those blood vessels and helps them relax. Magnesium does the same thing. And so you always kind of have this balance in your body, either the sodium trying to do the constricting, the potassium trying to expand it. But just in general, your blood vessels need to be able to do both at all times, right? Because your blood pressure needs to be able to change depending on what you're doing. Are you stressed out? Then you need to constrict. Okay, if you're ready to go to bed and to expand and to relax. And so you need to always have all your electrolytes. But with people with high blood pressure, you're usually getting too much sodium and you're not allowing your body to be able to expand those blood vessels and lower your blood pressure. I think that was a really good article. Beetroot juice is a good natural remedy used in combination with a good diet and in combination with your medication. And just to note that potassium is important. That potassium is very important. I'm going to keep saying it. The more potassium you eat, the more sodium you lose through urine. So keep that in mind.